Hi, how are you doing today? My name is Melissa Martyr, and I'll be your registered nurse doing your assessment. What brings you into the clinic?
Well, yesterday I was out and about, came home, and my arm kind of fell asleep. I didn't feel any feeling in it, just like fall asleep normally. And it's been happening, so I just figured I'd go to sleep. It was late at night, didn't want to bother anybody for, poor circulation. So I come in this morning because it's still there.
Okay, so this time it didn't go away.
It didn't go away.
Okay. Let's see. We need to do a stroke assessment on you. Let me see your arm. Can you tell me your name and date of birth?
Christina Buckley, and 10/30/1981.
Okay. All right. Can you tell me a little bit about your health history?
Well, was taking medicine for high blood pressure. I've been feeling fine lately, so I kind of stopped taking it, and nothing bad's happened. And I've cut back on my smoking. I'm trying to get healthier and all. So I'm down to half a pack a day.
Okay. It's really important to continue taking your blood pressure medicine, even if you are feeling better. But we'll talk more about that later. If you don't mind, we'll go ahead and do your baseline stroke scale. All right. Can you tell me what month it is?
June.
And how old are you, Miss Buckley?
34.
Okay. All right. Will you close and open your eyes for me? And then close and open your fist. Okay. All right. That lets us know that she is alert and keenly responsive. She is oriented and then able to follow commands, which is very important when you're doing a stroke assessment. It's a very good start. The next thing we're going to test is your horizontal eye movements to make sure there's no paralyzation there. If you'll just look at my finger and then follow my finger. Okay, very good. And right. Great job. Okay. All right. Now, if you'll just take your hand, this hand here, and then cover your right eye. And then if you'll just tell me how many fingers I'm holding up. Look at my nose.
2, 4, 5, 1, 3, 4, 2, 1.
All right. And then let your hand down. All right, and if you'll take this now, arm and then cover your left eye up. And we'll do the same thing with this eye. All right.
1, 2, 4, 5, 5, 3, 1,
How many?
2, 1.
All right, great. And let your arm down. We are testing your visual fields there. And that's just to make sure that we don't have any clear-cut visual field problems. At times when somebody has a stroke or a suspected stroke, they can have clear-cut asymmetry in their visual field, and that's what we're testing for there. Now we're going to test your extremities. If you'll take your left arm, please, and then hold it out, and we're going to count to 10 and just hold it right there for me. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great. And rest your arm. And do your right arm as well. Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. You can relax now. Great job. Now, what we're going to do is have you hold your leg out straight. We're going to count to 5 for your legs. We'll start with your left. Okay, 1, 2, 3, 4, 5. You can relax that leg. And then we'll do right. Okay, 1, 2, 3, 4, 5. Great job. And that's just to make sure we don't have any paralyzation in your extremities. Now we're going to test ataxia in the extremities. So what I'm going to do is we're going to take your pointer finger on your left hand, touch my finger, touch your nose, and we'll go fast. Great job. Now we'll do the same thing with your right. All right, good job. So for your legs, what we're going to do, we'll take your left heel and then raise it to your right knee, and then run it down your shin, and then back up. Okay, and we'll do the same thing, but with the opposite leg. Okay, and down. Great job. Take a break. Okay, so now I'm going to prick you with a pin to test sensation. And what you need to do is let me know if one side feels more sharp or more dull than the other. Okay? All right. The same or different?
Same.
Okay. How does that feel?
The right one doesn't feel the same.
It's different?
It's different.
Is it less or more than the left?
It's less. I didn't hardly feel it.
Okay. All right, now we'll do the same with your legs. I'm just going to lift your pants leg a bit. How did that feel?
It's the same.
Same? Okay. All right, so a bit of decreased sensation in your right arm. All right, now I'm going to hand you some pictures to look at. You can tell me kind of what's going on in the picture. The first one we're going to look at is this one. Okay, so just tell me what's going on in that picture.
The lady is washing dishes, and the sink is overflowing, and she's standing in the water. There's a little boy on a stool that's falling, reaching for cookies, and his sister looks like she's trying to get a cookie.
Very good. And then the next.
Glove, a key, a cactus, a chair, a hammock, and a feather.
Great job. What we're testing there is your ability to comprehend, your fluency, and then your ability to express. That's very important when we're doing a stroke assessment. The next thing we're going to do is show you some sentences and then some words, and if you'll just read them to me. Here are the sentences.
You know how, down to earth, I got home from work, near the table in the dining room. They heard him speak on the radio last night.
Okay. Great job. And the second set.
Mama, tip-top, 50-50, thanks, Huckleberry, baseball player.
Okay, very good. And we're just testing for dysarthria or slurred speech with that. Okay, the next test I'm going to have you do is just to close your eyes, and I'm going to touch you on the left side, the right side, or both sides, and you let me know what you feel. Okay?
Left, left, both, right, both, right, both, left, both, right, left.
Great job. Okay, we're done with your stroke scale assessment. It looks like you've scored a 1 for the decreased sensation in your right arm. Okay, let's talk a little more about your stroke risk factors. For sure, you have hypertension, you said, and it's going to be really important that you follow up with that and that you take your medication even if you're feeling better, because that's a risk factor for stroke. Also, smoking is a risk factor for stroke. You're just gonna have to quit. I have some information for you on some free stop smoking help if you're interested. We are gonna run some more lab work to make sure that you don't have any more risk factors for stroke, like diabetes or high cholesterol as well, while you're here. Also, when you notice symptoms like decreased sensation or weakness on one side of your body, slurred speech, anything like that, it's very important to get to the hospital very fast. There's a medication that we can give if you get there in time and you meet the qualifications to help decrease the symptoms so that they're not permanent, hopefully. So in the future, please make sure that you just go ahead and call 911 or go to the hospital immediately. I'd like to go ahead and give you the information on the stop smoking and the stroke booklet. This has got the information about how high blood pressure and the other risk factors like diabetes and high cholesterol factor into causing strokes, so that you're more aware and more informed. And then it's got information on healthy diets and blood work, and then it's got information on prescription help and the stop smoking line here as well. Okay, if you'll just hold on, we'll let the doctor know your baseline stroke scale, and we'll get your lab work completed and your testing done. Okay.
Thank you.
All right. It was great to meet you.
You too.
Okay.